Good morning. I'm going to report this morning about the review major infections and examples of sexually transmitted diseases and their appropriate treatment and therapy. Before talking about major infections and examples of STDs, I want you to know these facts. More than 1 million sexually transmitted infections or STIs are acquired every day worldwide, the majority of which are asymptomatic. Ibig sabihin, dili mahibaw-an nga naa siya ana nga mga infections. Almost 1 million pregnant nga mga babae were estimated to be infected with syphilis in 2016, resulting in over 350 adverse birth outcomes including 2,000 stillbirths and newborn deaths. Sexually transmitted disease or STIs have direct impact on sexual reproductive health through stigmatization, infertility, cancers, and pregnancy complications, and can increase the risk of HIV. Now, drug resistance, especially for gonorrhea is a major threat to reducing the burden of STIs worldwide. Now, here are mga major infections. Ang una is ang syphilis. Syphilis. Adunay tulo ka stages ang syphilis. The first is the primary syphilis. So kini siyang primary nga ginatawag, dili pa kaayo inana kadagko or kadako ang damage. So enlarged lymph nodes, mga ginagmay nga mga bukol-bukol, tapos spontaneously disappears without treatment. No, pwede ra siya without treatment after 4 to 6 weeks. Pwede ra di siya mawala kanang primary pala nga syphilis. Okay, look at this another one, another stage, the secondary. The secondary, look at mas daghan siya, di ba? Mas daghan ang labhag, mas daghan ang bacteria, ang nagkatag na ang bacteria sa tibok niyang lawas bisan gani sa dila. So, generalized skin rash, patchy lesions of mucous membranes, especially the mouth, involvement of the other parts of the body. Pero kani siya spontaneously disappears within weeks or months. Weeks or maabot siya months, followed after a latent period, years by the third stage. And the late syphilis, symptomatic syphilis. So, mo na ni ang reappearance of symptoms. Ibig sabihin, ni-appear na po balik ang mga symptoms and mas ni-grabe siya. Siguro wala na treat. Itong una, kabalik-balik. So, characterized by the occurrence of neuro and cardiovascular syphilis and of the characteristic lesions involving different parts of the body. When diagnosed and treated in its early stage, ang syphilis, dali ra jud siya maayo, is easily to cure. The preferred treatment at all stages is penicillin lang and an antibiotic medication that can kill the organism that causes syphilis. No? Pero kung allergic ka sa penicillin, ang doktor may suggest another antibiotic or recommend penicillin desensitization. Now, ang syphilis can be transmitted or pwede po siya moadto sa baby, moadto sa pregnant ka mama, moadto sa baby. The treatment is pregnant woman with diagnosed syphilis should be treated immediately. Dapat i-treat dayon siya, di na padugay-dugayon, di na hulaton nga mga anak pa siya. Their sex partners should also receive treatment to prevent the mother from becoming reinfected and to improve the health of her partner. That's syphilis. Another one, gonorrhea. Gonorrhea is an acute infectious sexually transmitted disease which can become chronic if neglected. So, kita na to ang picture sa gonorrhea. So, kita na to nga murag na inaganana nga part sa genital sa lalaki and babae. no? Even sa baba sa tao. So in males, urethritis with purulent discharges. Kaya naga-discharge. In female also, urethritis and or cervicitis with discharges gihapon. Ang gonorrhea can be cured with the right treatment. Pwede gihapon siya maayo. So, CDC recommends a single dose of 500 milligram of intramuscular ceftriaxone. Alternative regimen are available when ceftriaxone cannot be used to treat urogenital or rectal gonorrhea. Another infectious STD is chlamydia. Chlamydia. Ang chlamydia is a common sexually transmitted disease. It is caused by bacteria called Chlamydia trachomatis. Trachomatis. It can infect both men and women. Women can get chlamydia in the cervix, rectum, or throat. Men can get chlamydia in the urethra, inside sulod sa ihang penis, then rectum or throat. So dito siya naga-stay sa sulod nga part. Untreated chlamydia, pwede pod mo increase ang chances nga mahimo na siyang HIV or AIDS. So, dapat i-treat jud siya. Pareha sa uban. Pareha sa uban nga mga infections, dapat i-treat pod ang chlamydia. Antibiotic will cure the infection. Ang antibiotic ang ginagamit, ginareseta sa doktor. You may get a one-time dose of the antibiotics or you may need to take medicine every day for 7 days. Antibiotics cannot repair any permanent damage that the disease has caused. So, to prevent spreading the disease to your partner, you should not have sex until the infection has cleared up. Wala say sex. Fasting usa. If you got a one-time dose of antibiotics, you should wait 7 days after taking the medicine to have sex again. If you have to take medicine every day for 7 days, you should not have sex again until you have finished taking all the doses of your medicine. So, it is common to get a repeat infection. Pwede ka, kung na-infect na ka, pwede gapong ka ma-infect. So, ang buhaton lang, you should get tested again about 3 months after treatment. So that's chlamydia. Now next, we'll review about trichomoniasis. Trichomoniasis, or ginatawag ni siya og trich, is a very common sexually transmitted disease. STD. It is caused by infection with a protozoan parasite called Trichomonas vaginalis. Although symptoms of the disease vary, most people who have the parasite cannot tell they are infected. What's the treatment of this trichomoniasis? Treatment is, of course, antibiotic gihapon. Antibiotic medications like metronidazole, Holagia, Noritate, Novesa, and tinidazole, Tindamax clear up the infection in most people. A mga doctor will give you pills to swallow, either in one large dose or in several smaller doses. Take all of the medicine even if you start to feel better before you're done. Treatment will get rid of the parasite, but you can still get it again. About 20% of people get trich or again within 3 months of treatment. So your sex partners or partner should always be treated even if they don't have symptoms. So, mingon ka nga, wala may symptoms akong bana, wala man siya nga sakit, ikaw naa ka, or imong sex partner naa. So, kung wala siya symptom naa ka, still, kailangan gihapon siyang i-treat. Don't have sex for 7 to 10 days after treatment. Your doctor might want to test you again before you have sex. So that's trichomoniasis. And the last one is this acquired immune deficiency syndrome, what we call AIDS. So what is AIDS? No, we all know that the AIDS, it is a life-threatening clinical condition that represents the late clinical stage of infection with HIV, which results in progressive damage to the immune and organ system, especially CNH. Modes of infection. So, makuha ni siya sa sexual contact. Most important made especially homosexual and bisexual. No? Kani mga bayot, mga tumboy, lalaki, sex, babae, lalaki, di na ni kasagaran siya nakakuha. So, another one, makuha ni siya sa parenteral infection. So, gikan sa mga contaminated syringes, mga needles, especially by IV drug abusers. Now, another one, contaminated food, blood transfusion. Perina- Perinatal transmission. 25 to 35% of infants born to infected mothers are infected before, during, or shortly after birth. HIV is not transmitted by. No, paano ba man-transmit ang maong HIV or AIDS ngadto sa mga tao? So, ingon sila matransmit na kung magpakan kag insekto, no? Matransmit na kung maglibang ka sa CR nga gilibangan sa naisakit, like kissing, sharing of mga plates, spoon na or touching. So, ang tinuod dili na siya mao ang way nga matransmit ng maong nga sakit. So, katong giingon ako ganina, pwede siya matransmit to sexual contact, mga contaminated nga mga gamit, mga blood transfusion, mother to a child, to a baby. So, what's the damages na pwedeng himuon sa age sa ato ang lawas? So, look at this picture. No? Pwede jud niya dauton ang lawas sa usa ka tawo. So, pwede niya dauton ang brain, ang atong eyes, ang mouth and throat, ang lungs, ang atong stomach, atong liver, ang atong reproductive system, ang atong tibuok nga sulod. No? Pwede niya jud nga dauton. So, the question is, na may treatment ang AIDS? So, at this time, ang AIDS, there is no cure for it. But medications are effective in fighting HIV and its complications. AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. So sa US, most people with HIV do not develop AIDS because na taking HIV medicine every day as prescribed stops the progression of the disease. HIV pa lang ginatreat na nila before siya mahulog sa AIDS. So dili siya mahulog sa AIDS because ginatreat na nila HIV pa lang. Without HIV medicine, people with AIDS typically survived about 3 years. Once someone has a dangerous opportunistic illness, its life expectancy without treatment falls to about 1 year na lang. So, inana ang pwede nga mahimo sa HIV AIDS sa ato ang lawas. HIV medicine can still help people at this stage of HIV infection. And it can even be life-saving. But people who start art soon after they get HIV experience more benefits. That's why HIV testing is so important, no? Kailangan magpa-test jud para mahibaw-an, mahatagan jud og right nga treatment. So the treatment for HIV ginatawag na siya antiretroviral therapy. ART. ART involves taking a combination of HIV medicines called an HIV treatment regimen every day. So, ang ART is recommended for everyone who has HIV. ART cannot cure HIV, but HIV medicines help people with HIV live longer and healthier lives. So, mo ni ang ako ang report to review major infections and examples of STDs and their appropriate treatment and therapy. Thank you very much and have a great day.